Good evening to everyone and welcome to today's session. Dr. Srinu, Harish Ramsundaram, Akshay Purohit and many more who are all online. I wish you all have answered yesterday's question paper, the Sunday full-scale grand test. The full-scale grand test every Sunday online on the onlinembbs.com will give you the required challenge to know what are your scores. Out of 300, what are you scoring? What are the topics you are good at, not good at, which subjects you are good at, not good at. You get the complete analysis. And on Monday, we shall discuss some of the questions of that online test. So this goes religiously from April 1st to November 30th, every Sunday, 35 Sundays. And in the December, every day in the morning, there is a full-scale online grand test, evening discussion. 30 grand tests on in December. So totally 65 full-scale grand tests along with the discussion. So I wish that that's going to help a lot for you to know in what direction is the life going in the preparation for the NEET, PG and FMG. So with that preamble, Doctor, let's make the great beginning. Please tell all your friends to join this online community we created. It is just like Facebook, incus.live. So when you go to the incus.live, you have posts, friends, and you can send friend requests, you can chat with the people. You can also start your own groups and you can also start your own posts. It is like a Facebook of the student world globally. And you can also post a bit about your college. You can start a forum. You can talk about the strategies of preparation. Is Harrison good? Davidson good? Handwritten notes good? This coaching good? That coaching good? All this fun you can have in the form of videos, posts, photographs, and polls, etc., on the incus.live, absolutely free. So please take every opportunity to log in and register with incus.live. So let's begin, Doctor. Yes. Good to see Govind, Mohin Ansari, Arun, Ben, and many more. Good. Now, I will run very fast because I'm hoping that you already took the test. So there's a reason wherever it is required, we will try to add a little bit of momentum. Now, yeah. Which of the following groups of RNA viruses are the common cause of the viral meningitis? So you should remember that enteroviruses, all the enteroviruses are known to cause CNS disease. And that the major cause of the aseptic meningitis, which is caused by the viruses, is what you need to remember. Now, what are the main distinguishing feature between Mycoplasma? So you should remember that the Mycoplasma has no bacterial peptidoglycan, no cell wall. That's a key factor. Which organism there is no known animal reservoir? Bordetella pertussis. There is no known animal reservoir. Keep punching your answers, Doctor, so that it goes on and on and on. An important step in the mechanism, how human papillomaviruses are oncogenic. How do you explain? So basically they have a specific binding protein of certain human papillomavirus, early proteins which have the oncoprotein potential is what you need to basically remember. Autonomous parvoviruses, they lead to a spectrum of diseases. What is the reason for that? Because they require a host cell that are actively progressing through the mitotic cycle. You have a characteristic spectrum of autonomic parvoviruses. So basically, if you take Parvovirus B19, it can lead to the development of aplastic anemia because it infects erythroblasts, leading to anemia in the fetuses and in the immunodeficient individuals. So that's the point you need to appreciate. A 60-year-old man who is immunocompromised has received multiple courses of antibiotics. The blood culture has grown gram-positive cocci, and it is tested positive for the group D antiserum and is resistant to penicillin and vancomycin. So what is the group D organism out of all this which is resistant to vancomycin and penicillin? You have to be very sure about. It is Enterococcus faecium. Is the most likely vancomycin or a multi-drug resistant organism. A 60-year-old man, we are talking about the group D, Enterococcus faecium. Now, what is characteristic of a mycobacterium? Mycobacteria, they contain myconic acids that make it a mycobacterium basically. Mycobacteria are not heat resistant because they are susceptible to pasteurization, but they are aerobic intracellular organisms and they do not form any spores, as all of you know very well. What is a unique feature of chlamydia? So basically, in their replicative cycle, it is distinguished by two morphological forms that develop within the cytoplasmic vacuoles. In the host cell, the cytoplasmic vacuoles, they develop into larger metabolically active reticulate bodies. And finally, when they get released, they are called elementary bodies. That is a unique feature about the chlamydia. A 40-year-old veterinarian from the Coorg Reserve Forest in Karnataka presents with severe headache, myalgia, splenomegaly, scanty sputum, few mixed bacteria, scattered mononuclear cells. So what is the most likely organism? You should remember, we are talking about Chlamydia psittaci, which lead to development of psittacosis, is what I want to underscore to all of you. A 40-year-old veterinarian. So what is the important clue for you to say it is psittacosis? He is veterinarian by occupation. He is playing with the birds. Now, the diagnosis of the rotavirus infection. How do you make? It is the viral capsid antigens in the stool samples, because rotavirus is known to lead to development of diarrhea, as all of you know very well. A 26-year-old male marketing executive from Tirupati presents with the urethral discharge and dysuria. PMNs are detected in the exudate. Intracellular, extracellular, gram-negative diplococci. How do you want to treat him? So we are talking about gonococcal urethritis. So it is the ceftriaxone and doxycycline, the combination which has to be used is what you need to remember. Good to see Pradeep Reddy, Govind, Ben, and many more. Keep punching the answers, doctor. Please make it a interactive session. Once more, I like to invite you all to join this Facebook-like community that we created called Incus.live. Post some mnemonics, post some handwritten notes, create groups, invite your friends to join the groups, and post some polls, MCQs, and many more things that you can do on the Incus.live, which is a student community. I'm also reaching out to the top 1,000 rankers in the NEET PG last year, last before year, and last before year, who are now doing post-graduation. I want to request them to become the mentors so that they can help many more students who like to be guided. Right? Today, what is most required is knowledge is available everywhere. You hit YouTube, you have tons of knowledge on YouTube, tons of videos on YouTube, right? So I want to once more show you, doctor, quickly. Yeah. They're all modern generation of students. So honestly, you won't be needing an introduction, but still, yes. I like to quickly show you. Once you come to this portal, Incus.live, right? So as I told you, this is like a Facebook-like community. So it has got a section which is similar to newsfeed, just like the Facebook. So here, regularly, someone other will be posting a very relevant video, right? So, which a very good video available on the YouTube can be posted here. So a lot of very relevant content keep getting curated. You too can post some very good images that you want to challenge everybody to answer, etc., etc. So on the Incus.live, you can also see the other members, and you can reach out to the other students. So you can click, and here you can add the students as a friend, so that they confirm, just like Facebook. You know, this does not require big introduction. It's similar to that, but it is our own community, Incus.live. And I'm also going to get a lot of students who cleared USMLE, and our past students, almost, I have 2 lakh students in the past 20 years. Some of them are top consultants. I'm requesting them to come to the Incus.live so that we are all in a similar community to exchange a lot of things. Similarly, you can go to this section called groups. So here you can be able to create groups, right? You can be able to create a new group. You can invite others into the new group. And in the group, you can, it can be a study group of your own, and you can start having a lot of interaction. And you also can start forums. That's a very interesting thing. You can start a forum, and in the forum, For example, I started a forum called NEET PG Entrance Preparation Strategy. So if you go to the forum, you can be able to start posting a lot of things. You know how the forums work. So you can subscribe to the forum. You will get a email notification every time a new post is being posted. So this is basically a huge communion of medical students, doctors, and even patients also. I'm also asking a lot of patients too who have passed through an experience. For example, one of my patients who is an elderly person, he's about 83, he had a colon carcinoma and he has undergone hemicolectomy. Post-hemicolectomy, he lived with the colostomy and then he really passed through that situation. So when I told about Incus.live, he said, "Oh, doctor, I like to come on the platform and I can be a very good mentor to share my radiological images, and whenever a student wants to talk with me, I'm open to talk. How was my experience? How the clinical case started? Everything I can mentor the medical students. Always an experienced patient is a bigger teacher than sometimes even a professor of medical school. So that's the reason I'm also inviting a lot of patients to be part of it into this community of Incus.live. So please don't forget, also share it with all your friends to come and join the Incus.live. Now, doctor. Yeah, so continuing our discussion, pathogens in the genus Rickettsia typically they invade the endothelial lining of the capillaries and they lead to development of small hemorrhages is what I want to underscore to all of you. Now, with regard to the anti-GBM syndrome, anti-glomerular basement membrane syndrome, you should remember that it is called quasi-immune glomerulonephritis. Whereas, if you take post-streptococcal glomerulonephritis, it is immune complex glomerulonephritis. So, immune complex glomerulonephritis. That means immune complexes form and that exhaust the complement and that lead to hypocomplementemia if it is post-streptococcal glomerulonephritis. Whereas anti-glomerular basement membrane antibody, there are antibodies freely floating, they discovered the glomerular basement membrane, they attack it. There is no immune complex formation. Hence, complement level is typically normal, is what you have to basically appreciate. Now, doctor, leukocytes and white cell counts in the urine, where do you see them typically? So, in the case of the methicillin-induced renal insufficiency, which lead to development of interstitial nephritis, typically you find the leukocytes and WBC counts in the urine is what you need to remember. Elevated anion gap, elevated osmolar gap in a patient with renal failure. What does it suggest? So typically it is a feature of ethylene glycol ingestion. So you know, high anion gap metabolic acidosis versus normal anion gap metabolic acidosis. Causes of NAGMA and HAGMA. You have to be very sure. I don't once more repeat all that. But ethylene glycol, methanol ingestion, they present with an osmolar gap and they are metabolized to acids that cause this osmolar gap. Whereas isopropanol, mannitol, they don't metabolize. That's the reason they do not present with an anion gap, is what I want to underscore to all of you. Hyponatremia with a low urinary sodium. So whenever somebody has got hyponatremia, what are the possibilities? Either there is an increased urinary sodium loss, or there is a decreased sodium intake, or there may be redistribution of the sodium into extracellular, from the plasma into the extracellular tissues. So accordingly, the different causes: euvolemic hyponatremia, hypervolemic hyponatremia, hypovolemic hyponatremia. You need to know all the underlying causes. So if you take hyponatremia in a patient of congestive heart failure, in congestive heart failure, the cardiac output decreases, that decreases the renal perfusion, and it is associated with low urinary sodium. Then, because there is a lot of sodium retention, why in congestive heart failure, the renin-angiotensin system is activated, and that will cause the retention of the sodium. So urinary sodium will be typically low, so they have hyponatremia. Whereas euvolemic hyponatremia, there is no dehydration, there is no edema. Where do you see euvolemic hyponatremia, SADH, hypothyroidism, glucocorticoid deficiency? They don't have any sodium retention. And the main problem is free water excretion. So that's what you need to remember. Whereas thiazides lead to increased urinary sodium loss. So the table, what conditions are associated with high urinary sodium, low urinary sodium in a patient of hyponatremia? You need to take every opportunity to do the revision on onlinembbs.com. A 70-year-old man presents to you because he is not feeling well. He has malaise, he has achiness, ibuprofen he is taking for these symptoms. His urine shows protein and erythrocyte gas. A 24-hour urine shows 1 gram of protein per day. His creatinine clearance is 24 ml per minute. About 4 months ago, his serum creatinine was normal. So what is the likely diagnosis in this given case? So you should remember, how is the clinical presentation? Subacute presentation. Erythrocyte casts in the urine. Rapid decline in renal function. These are all consistent with vasculitis. And a positive ANCA will be supportive. The main clinching point in this is erythrocyte cast. If you take amyloidosis or NSAID-induced interstitial nephritis or light chain deposition disease, there is no business for erythrocytes to appear in urine. So that is the reason it is in favor of vasculitis, is what you have to emphatically remember. A 70-year-old man presents to you because he has not been feeling well for several months. His 24-hour urine, that is what we had been discussing, vasculitis presentation. So next time when you go to the exam, without a question on vasculitis, there is no question paper. So you should know how the Takayasu present, Kawasaki present, polyarthritis nodosa present, vaginous granulomatous present, cryoglobulinemia present. All these classical clinical presentations, doctor. you should be very sure about. The distribution of an affected and a normal allele in a community, typically this equation in population epidemiology, what is it called as Hardy-Weinberg's law? Which chemotherapeutic agent should be avoided in chronic renal insufficiency? Cisplatin, renal insufficiency. One important adverse effect you should not forget. How does Giemsa basically act? It activates the lipoprotein lipase, which is the mechanism. There is anemia, elevated indirect bilirubin and LDH level. Always. Which agent is known to lead to anemia with hyperbilirubinemia with elevated LDH? Ribavirin. So you should know the side effects. Hemolytic anemia, fatigue, pruritus, skin rash, sinusitis, fetal abnormalities. They're all the issues with ribavirin is what you need to remember. Cimetidine, gynecomastia. It's a very well-known question. Enterobacter cloacae, whenever it leads to UTI, what are you going to use? You should remember imipenem, meropenem. With which type of carbapenem you need to use celastin? Celastin, in which case you need not use celastin. Everything about carbapenems. If you have done this question wrong, you need to go back and do the revision docs. Which phase of cell cycle vincristine at? M phase. So you should know each of the drugs which are cell cycle specific. Which phase do they act? So what is the mechanism of nitroglycerin? Cyclic GMP levels elevation is the source of the secret for sildenafil, etc. Now, Redman syndrome, vancomycin. Octreotide, somatostatin, and if you look at rifampin, it is known to increase the seizures because it is a P450 inducer and that makes the anti-epileptic become ineffective. All class 1 antiarrhythmics, they have a greater effect on the cardiac tissue that depolarizes frequently. Now, metastatic choriocarcinoma, how do you treat? By giving vinblastine is the drug of choice. Pellagra is very prevalent in combined Andhra Pradesh and Telangana once upon a time, more so in Telangana. Crescentic glomerulonephritis, Pianka is the one which is associated. A 5-month-old has enlarging left testicle, serum HCG normal, alpha-fetoprotein elevated. You should only think of York sac tumor. Why females have a higher sensitivity to the ethanol? Because aldehyde dehydrogenase that metabolizes the alcohol. There is a polymorphism between men and women. Jogren typically has anti-law autoantibodies. Veterans typically is associated with Cianca, as all of you know. How does finasteride act? It prevents the conversion of testosterone into its effective form, dihydrotestosterone. There's a decrease in risk of breast cancer with multiparity, increase with nulliparity. 42-year-old runner participating in Asian game is having muscle pain, dark urine. That is an important clue to say that he had myoglobinuria, rhabdomyolysis leading to acute tubular necrosis. Regarding seminoma, seminoma in males often present in a pure form and has a good prognosis is what you need to appreciate. Minimal change disease. has got normal light microscopy, not electron microscopy. Now, a bright linear glomerular basement membrane staining. Where do you see that? Good pasture syndrome. A child has mellitus, hematocrit of 30%, elevated serum creatinine, cystocytes is an important clue. So cystocytes is suggestive of hemolytic uremic syndrome, which is often preceded by a bloody diarrhea, is what you should remember. What can a 4-week-old infant? A monoreflex is considered to be normal in a 4-week-old infant. Recurrent respiratory tract infections. When do they occur? So you are having the heart, right atrium, right ventricle, left atrium, left ventricle. So if at all there is any ASD, VSD, what will happen? All the left-sided blood will move into the right side and more amount of right-sided blood will flow into the lung, and increased blood flow to the lung will increase infections. But what do you have in tetralogy of Fallot? There is a pulmonic stenosis, infundibular stenosis. So there is a decreased blood flow to the lung. That is the reason you don't find any recurrent respiratory tract infection in TOF. So the murmur of the ASD, why does it happen? Because there's a lot of blood flowing from the left to right. It is because of an increased flow across the defect. In the differential white cell count, if there is a increased lymphocytes, it can occur in infants at 3 months, whooping cough, infectious mononucleosis. They're all the underlying reason for relative lymphocytosis. IPP in children quite often is post-viral infectious, post-viral. A 6-year-old has a transient macroscopic hematuria at the time of upper respiratory infection. So it is benign recurrent hematuria. So that is the reason you should think of IgA nephropathy where the complement levels are normal. Now, the extracellular fluid volume, how much it will be? It is 20 to 25% of the body weight, and the percentage of ECF volume tend to decrease as you are becoming an elderly person and aging. And a total body water represents smaller percentage of the body weight in an obese child than in a normal child. They're all the true statements. Hypernatremic dehydration. What is the complication? It can lead to the development of the brain damage, is what you should remember. 21-alpha hydroxylase deficiency. Yesterday we have discussed most commons in pediatrics. We already discussed most commons in medicine, most commons in surgery, most commons in pediatrics. Keep well glued with this YouTube channel of onlinembbs.com, and you are going to have 5,000 most commons from the 6 top question banks. AIMS, All India, PGI, JIPMER, DNB, and FMG. From the 6 question banks in a given subject, there are about 300 to 400 most commons which are asked in any entrance you go on this planet Earth. So that at least one time you need to have that journey through the most commons, 5,000 most commons. So doctor, congenital adrenal hyperplasia, 21-alpha hydroxylase. There is a high plasma 17-hydroxyprogesterone. It leads to ambiguous genitalia, if it is a girl child, and precocious puberty if it is a boy child, and it is associated with salt wasting because of the mineralocorticoid deficiency. Odland bodies, what is true? They help to establish a barrier to the water loss. They mediate the stratum corneum adhesion, and they measure around 300 to 500 nanometers. And they discharge their contents into the intercellular spaces, and they help in establishing a barrier to the water loss within the stratum corneum, and also they mediate the adhesion of the cells, is what you need to remember. So where do you discover Odland bodies? Odland bodies are found in the granular layer. You can remember grand old man, Odland means old man. Old man को क्या बोलते हैं? Grandpa बोलते हैं. So granular layer, you find Odland bodies. Now, doctor, parakeratosis. Parakeratosis means retention of the nuclei by the keratinocytes in the horny layer. Mainly it is because of an underdeveloped granular cell layer. And parakeratosis is physiological in mucous membranes. And what is psoriasis? Psoriasis is a focal scattered parakeratosis. So retention of the nuclei by keratinocytes in the horny layer is called parakeratosis. Usually focal in psoriasis. It's a physiological phenomenon. If you take the oral mucosa, is what you have to remember. With regard to the typhoid, incubation period 10 to 14 days. More common in males. Ampicillin for treatment of carriers. They're all true. But the highest incidence is between 5 to 19 years of age, is what you have to remember. Once more, very happy to see 28 online students. So those who have come a little late, don't worry, you are late but latest. Incus.live, www.incus.live. I want to see all of you subscribing, registering freely today on the incus.live, which is a huge social community, just like Facebook, student community, starting with medical students and down the line many more students from different walks of life. But medical students itself in India, we have almost all 70,000 students joining MBBS every year. Into 5 years is 3.5 lakh students are there. So we want a lot of handwritten notes, mnemonics, everything to be shared in the forums, posts, groups, discussions, etc. So please tell all your friends also to subscribe to www.incus.live today only. And we also keep posting a lot of free videos into the incus.live for you to do the revision of common exam subjects. And I'm also beg to borrow, steal, hijack. Top 1,000 rankers in NEET PG entrance in the past 3 years. 3,000 top rankers to get profiled on incus.live. And how I'm going to attract them to come to the incus.live. If you become a topper in NEET PG exam or FMGE, you're not the first guy to do that. There are many people who did that. Only you are changing from a cohort called preparing for NEET PG into a cohort called postgraduate. Once you pass your post-graduation, you are not the first to do that. Oh, thousands of people did that. You are only moving into another cohort called consultant. So when you become a consultant, you should learn how to get the attention of patients, how to treat the patients, how to take decisions to treat, how to build up your career as a doctor. So all our life is a drift from one cohort in academics and learning into another cohort. So I'm going to tell all the postgraduates who are erstwhile NEET PG toppers that please come to the Incus.live. On one side of you, you have medical students, interns, and those who are preparing for the entrance. Please become a mentor in their life. You share some questions, you answer in the forums, and etc. etc. On the other hand, I'm going to bring worldwide a lot of medical consultants, top consultants, into the group Incus.live, and they will be more than happy to handhold you. Someone in Johns Hopkins, someone in Harvard, someone in All India Institute. So top consultants are going to handhold you. So please come. That's what I'm going to sell the story to the toppers. A good number of them are our erstwhile students who attended with us the coaching, and also they attended at so many places. And I am also trying to pull a lot of coaching centers, mentors, gurus, who passionately spend their time to mentor the students to make them toppers. There's no competition that online MBBS will ever see, because we are the first about 23 years back to start the concept of coaching, helping people, or mentoring. So our own students started a lot of coaching centers. So we don't look at the things in that competitive angle. We want whoever want to contribute to come to the Incus.live community, contribute some classical clinical cases, post them, and let everyone debate on them. So we are more than happy to do that. So please take every chance to popularize www.incus.live. I'll be grateful if you can pull a lot of crowd of subscribers. Now, what is the dose of chloroquine at 4 to 8 years? 300 milligrams. The maximum density of microfilariae. Microfilariae also prepares for NEET PG exam. 11 p.m. to 2 a.m. is the maximum density of the microfilariae. About rabies, it is basically diagnosed by demonstration of the antigen by immunofluorescence, as all of you know very well. Yellow fever, quarantine period. These are all small numericals you have to be very sure about. You know what is the most common answer answered wrong by the thousands of students? Do you know what is the most common wrong answer? Everybody will be tempted for this figure 10 when you talk about yellow fever. There's a reason for that. Now, the breeding ground of the vectors of Japanese bee virus, paddy fields. Culex vishnui is in North India. And paddy fields are the favored breeding habitats. That is the paddy fields. Culex spends its honeymoon and produces a lot of beautiful little eggs and chota culex. So what is most dangerous to transmit a plague? Partial blocked flea is like a half knowledge. It is most dangerous. The most important reservoir of leishmaniasis in India. So a case of acute visceral leishmaniasis is considered to be the most important reservoir of leishmaniasis in India, is what you need to remember. Mass treatment of trachoma. When do you do? If the prevalence in the community goes to 5%. There are about 5,000 numericals, pure numericals. If you take the 6 top question banks, FMGE, NEET PG / All India, PGI, JIPMA, DMB, and AIMS. Pura 5,000 numericals in 19 subjects. फटाफट हम एक ग्रैंड राउंड्स में पूरा रिवीजन करके छोड़ देंगे. Are you all ready? So nowadays we are using a lot of data science analytics. You throw 30,000 questions into the data engine. You ask, please show me all pathognomonic questions. It will throw you out. Please give me all most commons. It will throw you out. So that is how we are able to come overnight with a masala items like 5,000 most commons, 5,000 numericals, 2,000 pathognomonics, 3,000 investigation of choice, 3,000 burst characteristic, 3,000 gold standard investigation type. So we can classify the data into different subsets to spice up your revision, basically. Fundamentally, what is topping an entrance exam? You should master from these FMG, NEET PG, PGI, JIPMA, DNB, AIMS. 1, 2, 3, 4, 5, 6. 6 question banks say 20,000 unique questions को जो master करेगा वो ही बनेगा, top 1,000 ranks में आएगा उनको seat. Simple. But the problem is what? Somebody says that coaching is good, this coaching is good, I want to go there, I am studying this. Somebody says NEET PG won't be there at all. We waste a lot of time. So don't waste time. Enjoy 200 days till we have time. Happily every day we shall study together a couple of hours. Right? And strengthen our essentials. Examiner is going to ask how to remember, how to master. Yesterday, Pradeep Reddy said a smashing mnemonic. I really loved it. Renal tubular acidosis is a type 1 or type 2 which is most commonly associated with nephrocalcinosis and stones. So Pradeep has proposed type 1 has got a stone. Wow. I'm a big fan of this beautiful mnemonic. So always the best mnemonics come from there, not from teachers. They come from the students. Because after teaching you, my job is over. But for you to remember is the biggest burden that you have. So when you have such a big burden to remember, obviously you will discover shortcuts. That is the reason today only take an opportunity to get into incus.live. www.incus.live. Become a member and you keep getting the volley of good mnemonics, good friends with whom you can friend, discover a study partner, milke pad sakte, sab kuch kar sakte. Right? Very good. Absolutely right. Lovepreet Singh after a long time. Learning is bi-directional. Absolutely right. Now, doctor, in a child survival safe motherhood program, CSSM, to conduct a delivery, 5 cleans during delivery, you need to remember. Clean the hands, hand washing. Clean place, clean cloth to wrap the baby, clean cord cut with a clean blade, not a used out rusted topaz blade. Clean cord clamp with a clean thread. Save the child. You should remember. The multi-drug regime under National Leprosy Eradication Program for treatment of all multibacillary leprosy. Remember CDR, C for clofazimine, D for dapsone, R for rifampicin is what you need to remember. In the heterosexual transmission of the HIV, there is a great risk of, in fact, greater risk of transmission from man to woman than woman to man. आदमी औरत को दे सकता है HIV ज्यादा से ज्यादा, not औरत to आदमी. A 50-year-old man has presented with pain in the back, lack of interest in recreational activities, low mood, lethargy, decreased sleep and appetite for 2 months. And her LFT, ECG, renal function, hemogram, everything normal. So how do you want to treat? So basically, all these features are suggestive of depression. And SSRIs, selective serotonin reuptake inhibitors like sertraline are the ones that are indicated. So doctor, you should remember antidepressants classification. जरूर एक क्वेश्चन आएगा. So another 3 days to go. All India Institute of Medical Sciences entrance. After it is over, I want you to post some good recalled questions in incus.live, right? And we will have a lagatar discussion on the question paper. Once more, 953 high yield topics that I told you, doctor, उसी के ऊपर आपका पूरा 200 MCQ क्वेश्चन पेपर आएगा. That's the reason spending 300-400 hours of qualitative time to do revision of those 953 topics to 20,000 questions. Most important key step to crack the NEET PG exam, doctor, or FMG or any damn exam. Drug of choice for depression to a Tollywood actor from Annakapalli who is planning to marry shortly. Oh my God, then he should be potent. So, bupropion, because bupropion has the least potential for causing sexual dysfunction among the antidepressants. Please don't forget. Now, doctor, all this will provoke anxiety, but not clonidine, isoproterenol, flumazenil, LSD, they all provoke anxiety. Isoproterenol is a beta adrenergic agonist. Flumazenil is a benzodiazepine antagonist. Clonidine is an alpha-2 adrenergic agonist, is what we need to basically remember. Now, doctor, infantile autism. What are the important features? So, infantile autism, withdrawal from contact with people, preoccupation with inanimate objects, including smartphones, developmental language disorder, and typically, if you take the infantile autism, it usually begins at birth and invariably present by age 3. So, a self-absorbing, profound withdrawal from the contact with the people, including the mother figure, a desire for sameness, preoccupation with inanimate objects, and developmental language disorders, they're all the components. A 30-year-old man presents with cough, shortness of breath, symmetrical hilar potato lymph nodes in the hilar area. So, but the only occupational exposure is there are birds in his house. So, sarcoidosis presents with bilateral symmetrical lymphadenopathy is what you need to basically remember. A 30-year-old man, sarcoidosis history. Now, a 56-7-year-old woman, palliative chemotherapy for a locally invasive right breast cancer. A lot of times breast cancer is more in the left hand upper outer quadrant. There's an increase in cough, chest x-rays performed, thickened septal lines, reticulonodular, interstitial opacification. The left lung is clear, but right pleural effusion is there. So what is the likely diagnosis? So typically in the background of a malignant history, metastasis leading to lymphangitis carcinomatosa, classical finding. Radiograph of an 8-year-old with the vitamin D deficiency reveals cupping and fraying of the distal tibial metaphysis. So, cupping and fraying. So, there is also a rickettsial rosary where there is an expansion of the costochondral junctions is what you have to appreciate. A 30-year-old man, chest pain. There is sclerosis of both humeral heads, pulmonary infiltrates, elevated position of splenic flexion. So what else do you expect in his chest radiograph? So you should remember, sclerosis of both humeral heads, pulmonary infiltrates, elevated position of splenic flexure means spleen is autosplenectomy. So it is a case of sickle cell disease. So typically sickle cell disease, there's an infarction of the central end plate, and that lead to a hedge-shaped or a codfish vertebra is what you have to emphatically remember. Now with regard to the hepatocellular carcinoma, hepatocellular carcinoma derives its blood supply from hepatic artery. That is the reason when you are doing the imaging, there is a rapid arterial phase enhancement. Hepatocellular carcinoma also invades the branches of the portal veins. And it is the most frequent site of the metastasis to the lungs is what you need to remember. And those mets going to the brain, they are hypervascular and they do not contain any calcification. So that's the point you need to appreciate. So when does primitive streak appear in the caudal part of germ disc? By 15th day of development. In a mature Graafian follicle, where does anthem folliculi lie? It lies between membrana granulosa and zona pellucidea is what you should remember. Death sentence, fire this guy who can, which magisterial power it is? It is the power of additional sessions judge. So what is capital punishment of the death sentence? Who can give death sentence? Both sessions judge, additional sessions judge can pass a death sentence. And to do the execution, it needs to be confirmed by the division bench in the High Court, comprising at least 2 judges. So how do you carry out death sentence in India? Hang till he dies. Whereas in America it is electrocution. And in the Turkey, they do garroting. More difficult to die. Membrana pupillaris completely disappears. By what time? After 28 weeks of intrauterine life. I leave this literature the online MBBS.com video library for you to do the complete revision doctrine. But mainly try to get these all the stupid numericals. There's no brainer involved in that. Postmortem of a newborn baby. What do you open first? The abdominal cavity. To detect the blood stains, what is more specific test? Treatment. Sexual perversion. It includes indecent assault, transvestism, sadism, but not sodomy. Very important to remember. The sexual offenses are divided into natural offenses, unnatural offenses, and sexual perversions. Sadism, masochism, where the partner takes a belt and pats on the back. Wow, kind of a feeling the person gets. Necrophilia, dead bodies के साथ someone get arousal is necrophilia. Fetishism, men wearing women dresses, women wearing men dresses. Transvestism, exhibitionism, masturbation, voyeurism, frotteurism, undism. They're all sexual perversion. There's no penetration involved. Whereas buccal coitus, Gomorrah's sin, the sin of Gomorrah, right? Cunnilingus, sodomy, tribadism, bestiality, they're all considered to be unnatural offenses. So you need to know the definition. One of the favorite question where people lose the wonderful 1 mark. Acrodynia, mercury poisoning. Neonatal meningitis, it is the Streptococcus agalactiae, the common cause. Clostridium tetani spore typically will be terminal and round. Tennis racket appearance. Serenese test is used to identify entero-invasive E. coli is what you need to remember. J chain is there in IgA. The bird flu is caused by a avian subtype influenza, which is basically called H5N1 is what you should remember. Cytotoxic hypersensitivity. It is the immunoglobulin G which mediates the cytotoxic hypersensitivity. Vidal is an example of a agglutination test. Cysticercosis is caused by the egg of Taenia solium. Whether you are a vegetarian, non-vegetarian, doesn't matter. A lot of people have a confusion. When humans ingest undercooked pork that contains cysticerci of Taenia solium, the scolex evaginates from the cyst and develops into an intestinal tapeworm. The tapeworm grows in length up to 10 meters and has hundreds of proglottids. The mature proglottids contain approximately 50,000 eggs. Ultimately, these free eggs or proglottids are released into the stool of the carrier and they can survive for months together. And any fecal contamination, whether it is non-vegetarian or vegetarian food, that can lead to the transmission. Infective form of malaria, is sporozoite. Malignant tertian malaria. What do you have? So there's a trophozoite, male gametocyte, female gametocyte, but not schizont. So in Plasmodium falciparum, schizonts are not usually seen in the peripheral smear, is what you have to remember. Occult filariasis typically is caused by microfilaria. Bancrofti is what you should remember. What type of bodies are Negri bodies? Negri bodies are intracytoplasmic eosinophilic bodies. Cowdery type A, cowdery type B, eosinophilic, basophilic. Oh my God. Microbiology kills the piece. But we need to conquer. That is the fun of preparing for entrance exam. So once more, doctor, thank you so much for all of you participating this wonderful evening. I invite you all to become part of our academic communion on the incus.live, www.incus.live, and let us all study together and discover many more study partners, mentors, and also our juniors joining, whom you can offer your mentorship to a first year student, second year MBBS student, if you already know how to crack passing the MBBS exams. Of course, everyone will pass exams, that's not a big deal. But let's make it a fun, study a fun, studying together a fun. Thank you very much. Once more, we will meet every day. And tomorrow evening, we have a wonderful class, Orthopedics by Dr. Ravikiran sir. So, upcoming sessions, I will try to add it like an event in the incus.live. So please do join. Thank you.